Hello, my name is Bella Blakeney, and today I want to take a deeper look into the ethics of physical therapy and the role of justice in the profession and within the care that patients receive. But first, let's take a look into my past and my experience as an athlete and dancer, and how that transforms with my journey with physical therapy and how that relates to moral courage. Physical therapy is a career I have wanted to get into for the past few years. Growing up, I have always wanted to be a professional ballerina and wasn't open-minded to any other career path. When I was 15 years old, I suffered a bad foot injury that took me out of dance for a few months while I was just observing from the sidelines. I was introduced to the world of physical therapy by my podiatrist, and at first I was hesitant it wouldn't do anything really beneficial for me. After a couple months of sessions twice a week, I was back on my feet dancing, despite the odds that I would never dance again, said by one podiatrist. I have been back a couple times for other small injuries and have fallen in love with the profession and have an interest in a change in a career path. I decided my junior year of high school that I wanted to be a physical therapist, and here I am, going into my sophomore year of college with a kinesiology major and a dance minor, hoping to get into PT school after my undergraduate. The more research I have been doing recently for job shadowing, interns, getting into a PT program, has lingered some questions in my mind about this profession and its ethical standing. There is a difference between moral and physical courage. When it comes to moral courage, it involves the ability to do the right thing in a given situation, where there is an easier but not morally right path. Physical courage can deal with pain, hardship, or loss. The physical courage I had to endure as both an athlete and student felt overwhelming at some times. In ballet, there was a lot of physical courage I had to endure. But as I would physically have to dance through the pain, suffered multiple eating disorders, as in common in the ballet world, recovered from those, was on my toes for 6 hours a day straight, and the list goes on. As a physical therapist, there is also a big role of physical courage in the daily workspace, as you work long hours to sacrifice your time and energy to those who are in a weaker position. As much as physical courage plays a role in this job, there is also a lot of moral courage as well. This falls into the moral principles that physical therapists must have on the job. The first would be compassion. Patients are not going through an easy time, as it is when they come in to receive care. So it's important from a moral point of view for physical therapists to understand their patients and be there with them through every step of the way to recovery. The next moral principle is respect. One must respect the patients physically and mentally, while keeping in mind the rights that patient holds. The third moral principle is integrity. This applies because it kind of follows along with respect, as the patient's privacy needs to be respected as well as their dignity. It can take a great deal of courage to still give valuable care to a patient no matter how hard of a time they are giving you or how disrespectful they are. The last moral principle is social responsibility. This shows a great amount of professionalism and is done by physical therapists understanding their community and nationwide issues. One topic of discussion that is important is how payment is received. Healthcare in general could do a better job and is quite complex in how one pays for their own health or medical coverage. From my own experience, I used to pay out of pocket for each session when I started going to physical therapy, summer going into my sophomore year. My insurance plan wouldn't cover my PT sessions, even though it was crucial for my steps to recovery. In an article by physical therapist Bruce Greenfield, he states, according to CMS National Health Expenditures data, overall total U.S. healthcare spending increased 4.6 in 2018, reaching nearly $3.6 trillion. CMS estimated that healthcare spending would grow an average 5.4% annually to reach about $6.2 trillion by 2028. This is becoming both unrealistic and unsustainable for the public. After my insurance changed, I was able to afford my sessions, but it was piling up before, and I almost had to stop going. This begs the question of how can we serve justice and use the available resources the healthcare system has to improve these circumstances and make physical therapy sessions of value to everyone and those that are in desperate need. As an outcome, physical therapy has switched over to VBP, value-based payment. and this has resulted in keeping costs low, keeping value high, and less mistakes and better outcomes. As much as value-based payments sound great, this has raised some ethical concerns along the way. The first question raised is, what differs a quality result from the patient versus healthcare workers' perspective, and do they have the same preferred use of resources? There is no one-size-fits-all approach, and it's almost impossible to align the values of the patient to the healthcare worker. There are a lot of different approaches now to payment plans and the value cost, but the patient's experience and satisfaction are important, and that is what keeps them coming back at the end of the day. In an article by Ian Edwards, he takes a look at the implications for physical therapy, ethics, and clinical practice. There have been recent revisions of physical therapy codes of ethics to take a look at the social injustice created. In this chart, we can see the series of questions separated from clinical practice questions to ethical questions, and how both end to the physical therapy moral agency in response to injustice in the healthcare field. The chart brings up questions such as, in what ways does or should knowledge about the social determinants of health and disability influence the practice of physical therapy? How should physical therapists address social and health inequalities? And then it goes to the ethical questions, and that's, do current ethical approaches in physical therapy incorporate an understanding of social determinants of care and the role of social systems and healthcare disparities? All of these offer and beg great questions. Although each patient gets a different kind of treatment and has different needs based on their circumstances, not one patient shall be looked at more important in the long run, as all patients want to be recovered and back to the way they were living. There are core values of physical therapists such as compassion, respect, integrity, and social responsibility. All in all, I think the world of physical therapy and healthcare is always improving and finding new ways to be ethically and morally correct with the rest of the world, and they are on the right path. Thank you.